Roper St. Francis Healthcare's House Calls TV.
For people with abdominal aortic aneurysm, there are several treatment options. Dr. Sean Hislop highlights one repair option that's minimally invasive and customized for the patient.
The aorta can get bigger than normal, and it's kind of like having a water balloon, in that if you put enough pressure in a water balloon and it gets big enough, it tends to burst. What we have is the ability to place metal stents covered in fabric, and we basically reline the aorta.
But because the aorta has many vessels that branch off of it and the distance between branches is unique for each person, a more individualized solution is now available.
We now have the technology to punch little holes in those metal stents covered in fabric that allow us to put other covered stents through those tiny holes out to the target vessels, actually build a graft custom for an individual patient.
This device helps patients avoid the risks of a major chest or abdominal surgery.
There's a lower risk of having injury to the kidneys, injury to the arteries to the bowels. Patients generally go home the next day.
For more information, call 843-402-CARE, and for more House Calls TV, visit us online at rsfh.com. I'm Angela May.
Roper St. Francis Healthcare's House Calls TV.